So I'm really excited to introduce Gary Drescher and Barbara Leffler. So Gary is a Parkinson Foundation ambassador who has lived with Parkinson's disease since 2017. He is a Vietnam veteran as well as a retired community manager. And Dr. Leffler is a Parkinson's Foundation hospital lead ambassador, and she's also a care partner to her husband, Gary. So she's a retired clinical psychologist and a registered nurse, and they're about to celebrate their 56th wedding anniversary this month. So they're going to talk to us. They're going to talk to us today about the Parkinson Foundation Hospital Safety Kit, which is very important to know before you might have the chance to go into the hospital, either for surgery or for some other unplanned event. So very happy to hear from them. Do you prefer this and hold it?
Thanks so much.
Thank you.
That's all.
Yeah, we do. He's just gonna
Yeah, we
scroll through
have
them.
to go back to a different.
There we are.
Oh,
Good. There we are.
Good morning. Just so there's no confusion, I'm Gary, the one with Parkinson's.
And I'm Barbara. I'm Gary's wife and care partner. For those of you who may not know us, the Parkinson's Foundation is a global organization whose mission is to make life better for people with Parkinson's disease by improving care and advancing research toward a cure. Can you hear me okay? People with Parkinson's disease are at a higher risk of hospitalization and face many challenges while in the hospital. This year alone, 1 in every 6 people with Parkinson's will experience avoidable complications while in the hospital.
As people living with Parkinson's, we need to be aware of the risks, prepare ahead of time, and know how to advocate for our needs while in the hospital. Barbara and I are here today to help you plan for a safe hospital visit. We're not here to provide medical advice. We'll begin with an overview of the resources available to keep you safe in the hospital. For most people, being in the hospital is a stressful experience. When a person with Parkinson's disease is in the hospital, their PD symptoms may worsen. New symptoms like confusion or thinking changes may develop due to stress, infection, fatigue, lack of sleep, surgery, or new medications. The already delicate balance of PD symptom management can become even trickier due to lack of movement, prescribing medications that worsen PD, and delayed or missed medication doses. As symptoms worsen, the person with Parkinson's is at a much higher risk for falls, swallowing changes, muscle deterioration, medication side effects, mental and physical decline, or decreased independence. This is known as the symptom spiral. Being prepared will help to avoid these missteps, and being here today is a good first step.
The Parkinson's Foundation, together with people impacted by Parkinson's, providers and specialists, has developed standards and recommendations to guide clinicians in providing quality care to people with PD while they're in the hospital. These recommendations include the importance of self-advocacy and honoring the role of the person with PD and their care partner in managing the disease. Based on the hospital care recommendations, the Hospital Safety Guide was designed for people with PD, their care partners and loved ones, to prepare for and navigate a hospital stay, whether planned or unplanned. The care standards are adapted into 5 Parkinson's care needs to help you and your hospital care partners communicate your needs during a hospital stay. The Hospital Safety Guide is a free resource which replaces the Aware and Care Kit.
It's important to keep in mind when you're hospitalized that your care team will be treating the health condition that brought you to the hospital, which may be unrelated to Parkinson's disease. Hospital staff may not be familiar enough with PD to understand all your symptoms, know why they fluctuate, or realize they can worsen quickly if you don't receive your Parkinson's medication on time. Lack of understanding about the importance of timely, accurate PD medications and symptom treatment can result in extended recovery time and life-threatening complications. By being prepared and communicating clearly with your providers, you can help reduce those risks. The Hospital Safety Guide has the information and resources that those of us with Parkinson's need to prepare for and remain safe during a hospital stay. It includes a step-by-step hospital planner, extensive discussion of each of the hospital or each of the 5 Parkinson's care needs, and tear out ready-to-use resources, all focused on understanding the risks we face in the hospital, organizing our care information for a planned or emergency hospital visit, advocating for ourselves when a crisis occurs, and using step-by-step instructions to get our 5 care needs met.
Need 1. I need my hospital chart to include my exact medications and match my at-home schedule. A different type or dose of the same medication may not provide enough symptom relief or may increase side effects. If the pharmacy does not stock one of your medications, ask if you can provide your own supply in the original bottle. Review your at-home medication list and exact times with the hospital care team. Otherwise, they may follow their standard hospital medication schedule instead of yours.
The Hospital Safety Guide has the information and resources that those of us with Parkinson's need to prepare for, and I went the wrong way. Excuse me.
Need to.
Need to. I need to take my Parkinson's medications within 15 minutes of my usual schedule. Those of us living with Parkinson's know that even small changes to medication timing can worsen symptom control and slow recovery. But nurses are often very busy caring for many patients, so you may need to offer reminders when it's almost time for your PD medication.
Need 3, we're going in the right direction.
Good.
I need to avoid medications that make my PD worse. These medications include those that block dopamine, sedatives, and certain pain medications. A hospital care team may prescribe these medications to treat nausea, confusion, and psychosis without realizing they can worsen your symptoms. The Parkinson's Care Summary in the Hospital Safety Guide lists safe and contraindicated medications for people with PD. Ask for a safe alternative if one of the hospital medications is not appropriate for someone with PD.
Need 4. I need to move as safely and regularly as possible, ideally 3 times a day. Hospital staff may not be aware of how important movement is to our well-being. So describe your typical physical activities and ask for safe alternatives. If it's safe to do so, continue your daily activities, such as walking to the bathroom, dressing, and sitting up for meals. And finally, ask to be seen by a physical or occupational therapist if you need help moving safely.
Need 5. I need to be screened for swallowing changes. Difficulty swallowing or dysphagia is common for people with PD and may lead to life-threatening complications. These screenings help maintain medication routines and minimize the risk of aspiration pneumonia and weight loss. Tell staff if you've had difficulty swallowing in the past and ask for a consultation with a speech-language pathologist. Sit up for meals, take smaller bites, and brush your teeth, tongue, and mouth before and after eating to reduce bacteria.
Each care need is described in much more detail in the Hospital Safety Guide. The guide also contains tear-out, ready-to-use resources to help ensure those needs are met. The first of these is the medical ID card. It lets people know that you have PD, that you need your medication on time, every time, safe medications, and medications to avoid, as well as precautions for those who have implanted devices.
The other ready-to-use resources are medication forms, where you can list all of your prescribed and over-the-counter medications with exact dosage and specific times. Forms for your personal care details and device-specific needs. The doctor's letter, to be reviewed and signed by your Parkinson's doctor, which outlines the 5 care needs and important care priorities. This will be important to give to your hospital care team. And lastly, the Parkinson's Care Summary for health professionals, for you also to give to your hospital providers. The summary provides an overview of Parkinson's disease, discusses 5 Parkinson's care considerations based on the 5 needs, lists safe and contraindicated medications for people with PD, and cautions for specific devices. The Parkinson's Care Summary and the doctor's letter both explain that it's necessary, not optional, to follow the exact at-home medication, dosage, and schedule.
You'll also find a step-by-step hospital planner that includes how to prepare for a hospital stay, the steps to take once you arrive at the hospital, and how to prepare for discharge.
You can do a lot today to prepare for a hospital stay. If you're joining us virtually, you can order or download your free hospital safety guide today by going to parkinson.org/hospital safety. The individual forms within the guide can also be downloaded and completed online. For those of you who are with us in person, we will have hospital safety guides, 1 per family, available during the lunch break for you to pick up at the Parkinson's Foundation table and also at the back of this room. Please don't wait for an emergency. Make sure there's someone that you trust who's prepared to speak on you or your loved one's behalf and serve as a hospital care partner when you need them. You may also call our helpline for additional information and assistance with getting yourself or your loved one with PD prepared for a future hospital visit.
Although we focused on the hospital safety guide and staying safe in the hospital, the Parkinson's Foundation offers many other free resources to the Parkinson's community. You can learn more at parkinson.org.
We've given you just a brief overview of the hospital safety guide today. There's much more detail in the guide itself. Gary and I are available to give more detailed presentations to support groups and community organizations. You can reach out to us today or contact us by email if you'd like us to speak to your group.